Hello there. I hope you are all doing good today. My name is Eunice. I'm a life coach from Eureka Global Coaching. I'm also a mental health advocate with certification in suicide prevention. Today, I'm going to talk about mental health. And I'm talking about mental health illness that is induced by childbirth. This is called perinatal mental illness. Perinatal mental illness is basically a mental illness that is induced or caused by childbirth. Sometimes, some women, when they go through childbirth, they suffer from some form of mental health illness. There are two types of perinatal mental health illness. There is the baby blues and there is postnatal or postpartum depression. What is baby blues? Baby blues is basically caused as a result of the low level of estrogen that is released in the body. Normally, when women are pregnant, they need a lot of estrogen. So the body produces a high level of estrogen in their body to help them cope with the pregnancy and help the baby to cope. During labor and childbirth, the level of estrogen is not needed in the body that much. So the level of estrogen reduces during labor and childbirth. This estrogen also has serotonin, which is released in the body and cause some feel-good factor in women. When this level drops, some women are not able to cope because their level of the feel-good factor in their system reduces and sometimes they begin to feel sad. So baby blues is associated with sadness, a period of sadness after the baby is born. And sometimes it happens maybe 3 days after birth or 4 days after birth. Some women go through mood swings, very sad, crying for no apparent reason, and they don't feel the need to even get up. They feel down and low in their spirit. And sometimes when this happens, it normally lasts for a period of 2 weeks or maybe 3 weeks. This type doesn't actually need any medical treatment. However, when this lingers on for a longer period of time, it can develop into postnatal depression. What is postnatal depression? Postnatal depression is a type of perinatal mental illness, and it's normally associated with anxiety, sadness, fatigue, feeling overwhelmed, crying for no apparent reason, and sometimes the mother begins to have some reduction in concentration. There is also appetite problems and trouble sleeping. Most women who go through postnatal or postpartum depression also find it difficult bonding with their baby. Normally, it can happen 3 months after delivery or 6 months after having a baby. Sometimes when nothing is done about this postnatal depression, it can spiral into something deep, into maybe clinical depression, and sometimes it can be postnatal mania. So there is the need for anyone feeling so low, crying all the time, feeling anxious, feeling sad after they've had a baby, to talk to a midwife. Talk to your midwife if you have gone through childbirth and you are feeling so low and you are feeling sad and you are finding it difficult bonding with your baby. Talk to your midwife. Talk to a trusted friend. Talk to a medical professional, and they will be able to help you. Don't bottle this up. Together, let us help to remove the stigma associated with mental health. I hope this helps. Thank you.